Individuals who have substance use disorders often have symptoms that include, but are not limited to, using a substance such as alcohol, heroin and opiates, cocaine or other stimulants, etc., in a way that demonstrates cravings, the inability to stop or cut down, and the consumption of larger amounts for a greater duration than intended. These symptoms become a disorder when they cause clinically significant impairment, including health problems, disability, and failure to meet major responsibilities at work, school, or home. Alcohol use disorder affects 14.4 million adults ages 18 and older in the US, yet only about 7.9% of those affected receive treatment. An estimated 88,000 deaths occur from alcohol-related causes annually, making alcohol the third leading preventable cause of death in the US. As is the case with other chronic illnesses, a person's risk of developing a substance use disorder comes from genetic and environmental factors. Significant risk factors include having parents with substance use or mental disorders, a current mental health problem, and a history of abuse and neglect. SBIRT stands for Screening, Brief Intervention, and Referral to Treatment. It is most used in the primary care setting. However, the emergency department has an opportunity to identify and link patients to care for substance use disorders. The use of SBIRT has been shown to be an effective method to address substance use in patients when delivered by a qualified healthcare professional. The most common components of brief intervention/counseling that have been shown to decrease drinking are 1. Express concern from the provider regarding unhealthy alcohol use. 2. Feedback linking the patient's drinking to his or her health issues. 3. Education about recommended drinking limits. 4. Offer of explicit advice to cut down drinking or abstain. 5. Follow up 2 to 4 weeks later to assess the patient's response. And 6. Referral to specialty addictions treatment if indicated. The most effective interventions are explicitly patient-centered and non-confrontational, asking the patient's permission to discuss, eliciting their thoughts, and using reflection are several methods recommended for engaging patients in behavior change. Longer counseling sessions are not necessarily better. 5 minutes of advice has been shown to be as effective as 20 minutes. Mark is a 58-year-old male admitted to the ED following a single-car MVC with injuries. Paramedics report a single-occupant, unrestrained driver at the scene. Airbag deployed and emesis noted on patient with smell of alcohol. Patient sustained injuries to face and lower left extremity. An ED patient is alert, but disoriented to place and time. Patient is complaining of pain to left leg. Upon exam, 4 inches of laceration noted to the lateral aspect of left thigh with glass shards in wound. 1 inch laceration to left frontal area of face, above the eyebrow. Superficial lacerations and bruising to face, anterior thorax, and left extremities. Diagnostic testing did not reveal any fractures. Ultrasound of abdomen/pelvis were negative. 5 hours later. Mark is alert and oriented. Laceration to left thigh was clean and sutured. Laceration above left eye was clean and sutured. Mark answered positively to universal screening question and NIAAA quantity and frequency questions as 5 days per week, averaging 3 drinks per day, max is 5 drinks. The first step in the SBIRT process is to raise the subject.
So Mark, I would like to go over the screening you completed related to your alcohol consumption. Would that be okay with you?
I guess so.
According to your results on the NIAAA screen, your score was 15. You fall in the at-risk range for drinking.
I don't see myself at risk for a drinking problem. I only have a few drinks a night to help me relax after a long day of work. I have earned the relaxation because my job is really stressful. I really enjoy a good bourbon.
The recommended amount of alcohol for men is 14 drinks per week. Tell me a little about your drinking. What is it you like about drinking?
I have a stressful job, so I like to unwind with a few drinks in the evening. Sometimes at home, and sometimes at the pub down the street from my house.
How often do you have more than 5 drinks at a time?
Not often. Maybe for a family get-together or special occasion or something, but I'd say just a couple times a year.
Has there ever been a time when you felt guilty or bad about your drinking?
No, not really. I usually don't have hangovers, and I don't drink that much every night.
Has a friend or family member ever told you they were concerned about how much you drink?
My husband gets aggravated sometimes when I come home late and have been drinking, but usually I drink at home, so he just goes to bed to read. He's mad at me now that I'm in the hospital. He blames my drinking. But I was tired. I guess I fell asleep driving.
Provide feedback.
Alcohol is a depressant. It can make you sleepy. It also reduces coordination between eyes, hands, and feet, making reactions slower. Even small amounts of alcohol can impair your ability to perform driving tasks.
I know all that. I guess my drinking has increased more than I thought, and it has started to affect my driving.
Enhance motivation.
Let's talk about your drinking. You said you drink alcohol to help you relax. What do you like about drinking?
Like I said, I drink to relax and unwind after a stressful day. I also like the taste of bourbon.
What don't you like about drinking?
I don't like the tension it caused with my husband. I don't like that I wrecked my car.
So I hear you say that there are some good things about drinking, but there are some negative things you don't like?
I mean, I guess so.
On one hand, drinking helps you relax. On the other hand, it has led to tension with your husband and caused you to be in a car accident.
I never looked at it that way. I don't know.
What do you make of everything that we have talked about?
I don't know. Maybe I should think about a change.
On a scale of 0 to 10, how important is it that you cut down on your drinking? 0 means not important, and 10 means very important. Using that scale, how important is it that you cut down on your alcohol?
Maybe a 5?
Tell me why you chose a 5 and not a 3 or a 4.
I don't know. I really enjoy a drink after work, but I don't like arguing with my husband. And now that I've wrecked my car, that's going to cost me. I don't know. Maybe I was really just tired and fell asleep, and this is all being blown out of proportion.
It sounds like part of you wants to cut back, but another part of you isn't sure.
That's right. I do enjoy the taste of bourbon.
On the same scale of 0 to 10, how confident are you that you can make a change?
5.
Okay, 5. Why not 4?
I've cut back before, but it just seems to creep back up on me. I'm pretty good at doing something I've set my mind to.
On the same scale, how ready are you to make the change?
6?
Tell me why a 6 and not a 5.
It's pretty scary being in a car accident and end up in the hospital. I know my husband's concerned for my health, but part of me thinks it's not that big a deal.
Refer to motivational interviewing techniques such as asking open-ended questions, reflective listening, summarize, affirmation, and elicit self-motivating statements. Negotiate a plan.
Since your husband has expressed concerns about you drinking, you were involved in an accident where alcohol was used, and you have had some success in cutting back on drinking in the past, I'm confident you can make some changes with your drinking habits. What are your thoughts about your drinking, and is there anything you want to change?
I'll have to think about how I would change my habits. I know my drinking has increased over the last few months, and I certainly got lucky and didn't kill myself when I wrecked the car. I'd have to find some other way to relax and unwind.
I have some strategies on how to cut down on drinking, and that may help with relaxation. Would you like to hear them?
I am open to suggestions.
How about talking to your husband and sharing concerns about the consequences of drinking? Maybe the two of you together could decide how much you would drink on a daily basis. Maybe choose some nights during the week that you will not drink. For stress management at the end of the day, maybe go for a walk or even meditate.
I used to walk my dog every night, but lately, I've just been getting home late. I let work take over. I did enjoy the time I had with my husband and dog. I think I only drink one bourbon during the week and not drink on the weekends.
It sounds like you have a plan. How about we check back in a month to see how things are going? Would that be okay with you?
Yeah, that sounds okay with me.